Welcome everyone to session 9, COVID-19 Best Practices for Nursing Homes. I'm Susan Ryan. I'm the Senior Director of the Greenhouse Project, and we really are delighted that you took some time today to join us to really put our focus on what we need to do to get better to support our residents and our staff at such a time of crisis. So thank you for being with us today. And I want to tell you a little bit about the ECHO model. We're really grateful for the ECHO model. It's not a webinar, but this is a way we leverage technology in order to identify those best practices that can support us all, that we're able to share them. We're able to share case-based learning, those presentations and scenarios that will all help us learn so that we can monitor and manage our outcomes so that we all get better. So I'm going to ask Mary to go to our agenda so we can talk a little bit about what we're going to be talking about today. Today's topic is all about social isolation and the return of nursing home visits. And I tell you, it has been so tragic to hear some of the tales of what has happened during this time when families have been prohibited from coming in to see their loved ones. So we have Ann Montgomery, who's going to introduce herself in a minute and talk to us about some of the research they have done. We've got two presenters today who are going to share case scenarios, Christy Stoker from the Greenhouse Homes at Clark Lindsey Village and Mark Rayner from the Greenhouse Homes at John Knox Village in Pompano Beach, Florida. We've got polls today and we've got a lot in store. But before we go there, I'm going to ask my colleague, Mary Hoffner-Thomas, to just go over some of the logistics that will help to support you in our call today. Mary?
Thanks, Susan. So welcome everyone. You are in listen mode only. So during today's session, would you please first go to the chat box and put in your name and your organization so that we can welcome you, so that you can say hello. Then when you have questions, go ahead and use the chat box for questions, and we'll have someone who's monitoring that so that there'll be certain times when we'll actually have the Q&A. The session is recorded, so everyone who is registered will actually get a copy of the registration along with some of the documents, and hopefully all of you received a copy of the agenda and the slides in advance. So all of that again will be sent after this session. So I think that's it. So welcome, enjoy.
Thanks, Mary. We're going to go to a map right now, and I want you to take a look at this map. We want to know who's calling in and from where are you calling. So these are the regions. So take a look at the regions and identify which one you are coming or calling in from. And Mary, if you'd launch that first poll, we'll get an idea of where people are calling in from. All right, the region. And guess what, guys? One answer, single choice. Take just a few minutes. We'd love to hear from all of you to kind of hear where you are calling in from. And if you are calling in from outside the US, there is an option for you to indicate as such. Just a few more seconds. All right, Mary, you can stop the poll. All right, the Northeast, once again, about 40% of you are from the Northeast, and it looks like 18% the Southeast. We've got a few in the Southwest and a few in the Midwest. And I've always loved to see those of you from outside the US. 8% of you are calling in from outside the US. So we welcome our international guests as well. I'd like to introduce some of the other folks that are joining me today. My colleague Marla. Marla, you want to introduce yourself?
Hey everybody, Marla DeVries from the Greenhouse Project. I will be that person that will be monitoring the chat box, looking for your questions, bugging you for questions, and helping to facilitate that Q&A at the end.
Thanks, Marla. And one of our subject matter experts, Eric Riguera. Eric, you want to introduce yourself?
Hi, good afternoon, everyone. Thanks for having me back.
Thank you.
My name is Eric Riguera from the Jewish Home at Rockley. here in Bergen County, New Jersey. Thank you.
And we are so thankful for your clinical leadership, Eric. Thanks so much. Dr. Al Power.
Hi, everybody. Al Power. I'm a geriatrician, educator, consultant from an undisclosed location in Rochester, New York. I'm just hanging tight. If the election's declared a draw, I'm ready to step in and take over. But otherwise, I'll be hanging on the call with everybody.
Thank you so much, Al. We're always so grateful for your perspectives. I want to welcome Christy Stoker. And Christy, just ask that you would introduce yourself to everyone.
Sure. I'm Christy Stoker from the greenhouse homes at Clark, Lindsey in Urbana, Illinois. I've worked here for 28 years. Our greenhouse homes have been open since 2017.
Thanks so much. And we're going to hear from Christy in a bit. Mark Rayner, you're up. Welcome.
Hi, good afternoon, everyone. Mark Rayner. I'm the Director of Healthcare Services, the Administrator at John Knox Village in Pompano Beach. Our community's been here 55 years. I've been at John Knox for 12. We opened our greenhouse homes in June of 2016.
Great, and welcome to both of you and to all the rest of you. And again, please introduce yourself in the chat box. Before we introduce our guest speaker for the didactic presentation, I thought it would be helpful to do a couple polls. So I'll ask Mary if she would launch the first one. And these polls will really help us better understand kind of what you're sitting with right now. Does your nursing home assisted living have a plan in place to combat social isolation and loneliness among elders for this winter? So talk to us a little bit about your plan. Just eager to hear what you're doing or what you've thought about and what your plans might look like. Give you a few seconds to take a look and read these. Thank you so much for responding. Okay, Mary, you can stop the poll. We are working on it right now, and perhaps that's why you're here. So 29% of you said that, 21% said you don't have a plan yet, but you'd like to develop one. 18% of you said you've already developed one. All right, we have one more poll question before our speaker. When it comes to access to tablets, iPads, or computers to stay connected with friends, family, and life outside the nursing home, please select all that apply. So this is multiple choice. So let us know kind of what you've used and what you're using to really support connections. And if you've got something that's not listed here, feel free to put it in the chat box. All right, Mary, you can close the poll. All right, 65% of you say elders have easy access to tablets or iPads or computers at the nursing home and assisted living, but not in their own room. Another 35% said elders would need training and assistance on how to use tablets or iPads. And 26% of you said that elders have access to their own tablets, iPads, or computers in their own rooms. Well, thank you so much for those responses. That's very helpful, very insightful. And now I'd love to introduce Ann Montgomery. I've known Ann, met Ann years ago when I first began work with Greenhouse. I have so appreciated her passion for culture change broadly, and especially the work that she has done most recently. So Ann, welcome today, and I'd love for you just to share a bit about yourself and then launch into your presentation. Thanks so much for being here.
Thanks so much for having me. I feel very honored to be here with all of you today. And I am co-director of the program to improve elder care at Altarum. Altarum is a health services research organization. We're headquartered in Ann Arbor, Michigan. I've been there since 2013 when I left the Senate, where I worked for 7 years for the Senate Special Committee on Aging. So I did a lot of policy when I was on Capitol Hill, a lot on nursing homes. So many of the things all of the things really that ended up in the Affordable Care Act, like the payroll-based journal, staffing reporting, and other things, are what we developed when we were having hearings and trying to figure out how to make nursing homes even better. And one of the things I hope that we can get to at some point is that there's an authorization for a national demonstration on culture change in the Affordable Care Act. It's in current law. So I do hope that we can actually do that someday. And if we do, it'll be because of the work that you all have been doing for all these years. So thank you for that. All right. So I should go ahead and share my screen. And all right, hopefully I will do this correctly. Okay. Are you seeing it? Okay, wonderful. All right. So as I said, it's wonderful to be here with you. And I know all of you are part of a wonderful network that focuses on quality improvement. So I'm excited to be part of this network now. And I just want to thank Susan Ryan for the invitation to speak today, and salute the Greenhouse Project for the work that you've done over the years to reshape the nursing home model of care and the larger culture change community. The nursing home model does need to be reshaped somewhat, and perhaps we can get to that a little bit in our Q&A when we do that. And how we do it is, of course, an ongoing discussion, and one that I did participate in a lot on Capitol Hill. And now I'm a researcher who can ask and try to tackle and try to answer tough questions in ways that hopefully will inform both practice and policy. So today, I'll focus on the impact of a policy shift that was brought about by COVID-19 and its impact on nursing home residents. And that is, from mid-March through mid-September, visitation of family and friends was essentially not permitted or allowed only under very narrow circumstances. Okay, now I have to figure out how to move to the next slide. There we go, okay. So with my colleagues Sarah Slocum and Christine Stanek, we set out to design and field a survey to lift up resident voices. And residents are normally very hard to survey for a number of reasons, and I give many thanks to my colleagues at Altarum who had the faith that we could actually pull this off. And here's how we did it. We distributed a public link in July, and we left it up until the end of August. And some of those who helped us distribute that link are on this slide: Consumer Voice, Ombudsman, Leading Age, AHCA, experts from all over the culture change community. We were really fortunate to have a lot of helpers. So this is a convenient sample, and we ended up having 365 responses from 36 states, which is, I think, a very respectable sample. The survey itself had about 30 questions, and it was designed to focus mainly on social isolation and loneliness before the pandemic and then after the pandemic hit. There were some questions on overall safety, quality of care, staffing, and advanced care planning too, which I can touch on a bit later. And importantly, we included one open-ended narrative question that allowed people to say whatever they wanted. And as we'll see in a couple of slides, residents did have a lot to say. Okay. So here's the backdrop for our survey. In the summer of 2020, about 40% of the deaths from COVID-19 that were occurring were among nursing home and assisted living residents, which I believe has not changed dramatically. And because the long-term care residential population represents only about 8%, or maybe a little less, of total cases in the US, this high mortality rate really serves to underscore the vulnerability of older adults living in congregate settings. So regarding the second bullet, there have been and will be, I hope, actions taken to ensure that nursing homes are able to access personal protective equipment. The fact that nursing homes have arguably been overlooked in this regard, at least early on, is terrible, but it's also a very fixable problem. And if we solve it, I think we will help decrease the risk of inadvertent transmission of the virus by staff, many of whom come from households where their living conditions may be relatively crowded, multi-generational, and in communities, we were talking about this a little earlier, where the positivity rate may be higher than we would like to see it, i.e. in the double digits. That said, it's really noteworthy, I think, that the Greenhouse Project has reported lower death rates from COVID-19, likely due to good infection control and deployment of PPE, as well as consistent assignment of staff, which is a hallmark of the model. And I think we all look forward to hearing more analysis of the Greenhouse data when that's available, and also data from the homes that you all are involved with where you are able to keep case and transmission rates very low. That's incredibly important that we understand how that happens. However, as a proxy for where many nursing homes were with regard to basic infection control, the Government Accountability Office, that's another place I worked earlier in my career, found that prior to the pandemic, the infection control problems were pretty widespread, with 82% of surveyed homes having received a deficiency citation. That indicates there's a lot of room for improvement, and infection control, as we know, has been at the forefront of what CMS has been emphasizing. Still, the emphasis on infection control and safety, if it comes at the expense of not thinking carefully about the downstream impacts, can be extremely detrimental to residents, and that's the storyline that we're following today. We already know from the literature that social isolation, which is physical separation from other people, is associated with increased risk of dementia. Isolation and loneliness, loneliness being feelings of distress at being alone, are associated with a higher risk of heart disease, stroke, and a higher prevalence of vascular and neurological diseases. And in people living with dementia, some studies have found that loneliness is more prevalent, and verbal agitation, which as we know can manifest in cries and screaming and repetitive vocalizing, is more common in residents with cognitive impairment and among those who are lonely. And this means that visitation can be particularly tough, visitation restrictions can be particularly tough on residents with dementia. Here are some of our survey findings. Residents reported feeling cooped up, cut off, bored, frustrated, and purposeless. We identified several forms of isolation: isolation within the nursing home from other residents and parts of the home where group activities and meals are usually hosted, isolation from family and other loved ones who live in the community, isolation from the out of doors, even right outside the nursing home, and isolation from the larger community. So I won't read the actual figures here to you, but I think you'll agree it's not surprising that a large majority, 76%, reported feelings of loneliness given their degree of social isolation. This slide speaks to isolation from the larger community that has been very common during the pandemic. The wider public may not really realize this, but there are quite a few residents who are able to access and manage transportation to and from the nursing home where they are, and who enjoy maintaining links to their communities. For example, they attend church, they may have a favorite park that they like to visit, a favorite shop, a restaurant. And these connections really have withered during the pandemic. And unfortunately, 64% of respondents to our survey said they didn't even leave their rooms. So what are the remedies to these rather extreme circumstances? Well, one effective way is to connect the world to the world and to loved ones virtually, as we were looking at in terms of that polling question, and as we are doing right now. But how wired are nursing homes? We set out to try to discover something about this in our survey. So we asked residents whether they had access to Wi-Fi. 67% said yes. That's not too different from what we heard earlier a few minutes ago. We asked residents if they had access to either their own computer or device or could use one that the nursing home makes available. 47% said yes. And finally, we asked if the nursing home tried to organize participation in online activities, a concert maybe, a book club, exercise class. And here the answer was either no, 45%, or I don't know, 28%. So one conclusion that we might be able to draw from this is that nursing homes might be able to focus on programming, of which there is an astonishing amount online these days, and that this would be beneficial. And I'm betting some of you in the audience probably are doing this already, or at least thinking about it. So given how infectious and lethal COVID-19 is for frail elders, we thought it was really important to understand how safe residents feel. And here you can see that a third of respondents say they have no concern about contracting COVID-19, close to half are somewhat concerned, and a fifth are extremely concerned. This range may suggest that it is a good idea to ask residents directly how comfortable they are or are not engaging in social activities that involve any level of risk due to personal interaction. However, when it comes to staff, residents by definition need to interact extremely closely with direct care workers, nurses, and other providers. So we asked residents for their observations about the use of PPE among staff. And here we see that residents residents reported seeing staff wear personal protective equipment most of the time. That's good, 78%, but there's still some room for improvement. And we know, as I said a minute ago, that PPE was not initially prioritized in nursing homes, which were treated rather differently from hospitals, despite caring for a very fragile population day in and day out. We can also see that staffing, a perennial problem in the long-term care residential sector broadly, remains what I think is a substantial and significant problem, with half of respondents saying that despite the increased work needs, there were fewer staff available to provide care after the pandemic hit. That's a big discussion, the staffing discussion, hopefully something that policymakers will be able to take up. And I'm sure that all of you have some good ideas on that. Here's a slide, and the next one as well, that comes from the open-ended narrative question where residents told us exactly how they felt in their own words. And as you can see, they felt pretty terrible. And it's not because they are afraid of the virus so much, it's really because they feel helpless and abandoned. The word prison comes up a lot in many of the comments, and there is a deep longing for the touch of those who are dear to them, whom they really, really miss. And here are some more responses. Residents feel like they have little to live for, which can manifest in loss of appetite, acceleration of dementia, even premature mortality. Residents are really aware that they don't have a lot of time left and they don't want to be shut away and cut off from those who are most important to them. And the little things like getting your hair done really matter. We didn't want to issue a report that found there were problems and not offer any practical solutions. So we spent some time with people like yourselves, asking them for their ideas on what could be done and what is being done to mitigate social isolation and loneliness, because these are highly curable maladies. And of course, we also come through reports in the literature. So for providers, here's some ideas you can think about and take action on and add to. The last bullet here, which notes that staff can survey their own residents about activities that they feel comfortable pursuing and want to pursue, is a very simple idea, I think, and very actionable, one that makes a big difference potentially in residents' lives. Not everyone likes to play bingo or chess or whatever, and it may or may not be easy to arrange certain things that used to be easy at this point anyway. I'm happy to say that in a project, we have a different project, a comprehensive culture change project running in Michigan. One of our homes is implementing the approach in that last bullet. They're surveying their residents about the activities they'd like to engage in and populating their calendars, their activity calendars with those activities and trying them out and seeing how well they work. And with any luck, we'll help them turn it into a QAPI project, a quality assurance and performance improvement project. Okay, this slide focuses directly on staff. And may I say that nursing home staff are doing work that is every bit as heroic as the work being done in our hospitals. Yet, this is not noted very often, not pointed out often in the media. So I'd like to say a big thank you to all the staff out there who are working so extremely hard and providing care and support under the most stressful circumstances we've seen since the flu pandemic of 1918. So I won't read all of the ideas here on the slide, but I hope you'll find them useful. In general, supporting staff as much as possible so they can remain safe, sufficiently nourished, rested, and so on is key. Staff flexibility, including having administrative staff step in for certain tasks, perhaps setting up meals in residents' rooms, is a very good idea. Teamwork is the dream work, right? And clear communication within the home, including with residents and with families, is absolutely essential. On that last bullet, we really can create better training programs and career trajectories that demonstrate to those on the front line that there is indeed a way for them to acquire additional skills over time in advance. This has been talked about for many, many years, and I think it's time to implement it on a wide scale. So that'd be fun to talk about. Here are several ideas for policymakers that basically aim at encouraging them to keep a clear ongoing focus on social isolation and loneliness. It's not going to go away. We're facing a pretty tough winter. And since there are so many creative ways, luckily, to address it, the more we discuss ideas, identify them, disseminate best practices, the more progress we're going to make. And that's one of the enormous values of the ECHO project and the ECHO network. Okay. This slide shows you that there is momentum on these issues, I think. And even as many nursing homes are struggling financially, and it's not clear how that will play out exactly, it seems evident that the industry overall is being challenged to be safer, with more medical expertise and infrastructure readily available, and equally important, challenged to be very attractive places where those who need complex care actually want to live out the end of their lives. That's the square that we have to circle. And with the talent that we have here and elsewhere, I'm sure we can do it. I do think there's a pretty good chance that we'll see legislation moving forward in the next Congress. There are a couple bills out there that are really quite good, I think. Senator Grassley's bill and Senator Casey's bill. If you haven't looked at them, I encourage you to do so. And I believe that they will gain momentum in one form or another and be likely to move forward. We also have a National Academy of Medicine consensus study that is just getting up and running. Here's a quick slide on many of the resources that we found, and there are more in the report. Happy to send a link to the report to anybody who's interested, or maybe we can chat it in. And finally, here's who we're serving and who we want to make happy. So I'll just read this because I think it's so cogent and so poignant and so great. I want visitors to be able to come inside to see me. I don't want to be restricted to my room all day and night. I want decent food and to have access to it. I want to be able to walk outside my room and see my friends and family that I would usually see daily. I want to regain my strength and have a better quality of life and independence. I want to be informed regularly about what the facility is doing and what is going to happen. I want to have my rights restored. I want to have the freedom to come and go like everyone else. So our mission, should we choose to accept it, and I think we all do, is to help residents achieve this. Thank you.
And thank you. That was incredible, very inspiring, and certainly very poignant and very insightful, especially powerful the way you ended it. So I'm going to encourage everybody to put your questions in the chat box. And while you're doing that, I would love to open it up to our panel of experts. Eric, Al, Mark, and Christy, if you've got questions, please feel free to ask Ann at this point in time. And I will call on you if you don't speak up.
Well, I hate being called on, so I'm going to just go ahead and talk. Thanks so much, Ann, for the presentation. It's so great that someone's actually doing a survey trying to get the resident voices in this whole business and understanding that. And to me, I'll make a comment that you feel free to comment on, because you've worn all these hats. You've worn the policy hats, you've worn the provider hats, you've worn all these different things. But to me, there are several areas that we need to tick. And one of the immediate things is, how do we start to enable visitation? We've got 2 talks coming up on that, so I won't say any more there. But another thing is really looking at policy, looking at current regulatory policy, and understanding that we need to find nuances. I just looked at CDC earlier. We had 106,000 plus new cases yesterday in the United States. So the pandemic's not going away. Certainly with the flu season coming, it's not going away. I think it was absolutely appropriate when we were first confronted with an emergency to kind of shut down. But we are now living in an age that does not have an end date. And so it is time to open our eyes and say, okay, this is, at least for the foreseeable future, a new normal. What are the nuances in policy? Because we know that isolation is dangerous. We know that sitting immobile in a room being quarantined is dangerous to a vulnerable person's health. So we need to not just look at black and white, but we need to balance the risks of one versus the other, instead of saying we just need to lock everything down. And so that is going to lead to a lot of interesting discussions. I think also from the largest societal area, there's a lot that we need to do about the working conditions of people who work in long-term care, particularly people that provide hands-on care. We need to make sure people are being paid a living wage for this job, but not only that, but the kinds of incentives that make people not get full-time lines and have to take jobs at 2 or 3 different places to fill their wages, because that spreads the virus as well. And so incentives for homes to hire full-time staff and not just hire 16-hour-a-week people that don't get benefits and make them work somewhere else. There are a lot of societal things, I think, that need to change, and it's really a multifaceted approach. But I do think that we have to just assume that this is the age we're going to live in for some time, and we need to start opening our minds beyond just the emergency response and talk about how we're going to make this more livable for everybody.
You're here. I completely agree. And I do think that the policy shift that CMS made in mid-September, September 17th, if I recall, is a good one. Obviously, they, kind of reopened the doors, if you will, to some visitation, and they heard, what many of you were saying, and many families who were pretty desperately concerned, as well as residents, as we now know, doing rather poorly. So to me, the nuance in policy now really comes from the practices that you all employ, that you figure out. The Quebec government has a kind of a neat term I like. It's called distance socializing. That's the term that they use. In other words, you can still socialize, yes, but you have to do it safely. You have to do it with the right PPE or under the right conditions, and make sure that, that's okay. But that does not mean, that you don't socialize. That's not the right answer, and particularly not in the long term. So I think policy is at its best when it's informed by practices that you all are developing, and that you use, and that you talk about, and you write down, and you get them out the door so that everybody else can find out about them, and they make their way back to stakeholders and to policymakers who are, at higher positions, whether at the state level or at the federal level. That's how I think policy works the best.
Eric, do you have a question?
Sure.
Comment?
And that was a great presentation and a great survey. Actually, it's totally reflecting on what's happening not only in our building, across the United States. As what Dr. Alpower said, you really have to understand the guidance, the policies and procedures, what the Department of Health and the CDC always brings out. As I keep saying, it always changes, and you really have to understand it and take advantage of that, understanding what's allowed, what are doing with the visitation in our state, and really understand it and fully understand and take advantage of it, such as the compassionate care visits, end-of-life visits. As I said, I was talking to the group before, in the state of New Jersey, this is what you call an essential care visits. And it's not only a casual visit, according to the Department of Health, but, there's some criteria, and always understand it, what is for the elder, always ask the elder what, it's a must that what we need to do this for a volunteer or a family member to come in, and they will do the specific activities of daily living. So take advantage of that. So always explore whatever the policies and procedures, what the guidances are giving to the buildings and to the facilities, and also never give up finding innovative ways. Like what we did, we put all echo dots in the rooms. It's a $20 item, but it makes a big deal, and again, $20. I mean, you spend $10 for an isolation gown. Well, what is $20 for the elder? Very simple innovation, but yet it comes a long way, and it's very advantageous. Also, find the talents of the staff. We have, hair is very important to the elders, and unfortunately, we cannot allow to have hair salon services in the building until now. I mean, it's quite shocking, actually. But find the talent of the staff. We have a staff here who he's saying I can be a barber, which he cuts the elders' hair, the gentleman's elders' hair. Also, we have a couple of CNAs that, they set and wash the elders' hair. We took advantage of that. Every Friday and Tuesday, this is what we do. We pull them out on their, what they're doing on their daily assignment or routine, and this is what they do the whole entire day. And again, you do the best you can for the elders. And again, always find those ways, never give up. Find those innovative ways. And plus, however, that's what Dr. Al said, always find that person and always give that compliment to every employee. I mean, that is so important. It comes a long way.
Yes.
Real quick, Susan, Ann, amazing job, and I want to be sensitive to time. And Eric, you really encapsulated it well. I think your presentation was perfect, and I think we as caregivers should share that with our teams. They do have COVID fatigue. There are opportunities we need to rebolster because, as I said, this journey is far from over. we were creative also. I had a Shabazz who was a former beautician, and she was doing hair. You got to get creative in this gang. Absolutely.
Christy,
Yes.
any other real quick comment from you before we move on?
No, I just want to thank you really for the work that you do and the creativity that you are showing. I do think that's what it's all about. And at times of challenges, to square a circle, you need creativity. You can't do it geometrically. You just have to figure it out and make it happen in unusual ways. And it sounds like you're doing that. And so God bless you. And you know, write me emails about what you're doing, and I'll help you disseminate your best practices. I think we ought to keep going on this. So thank you so much for the opportunity.
Great. Thank you so much, Ann. And Marla, is there a question for Ann before I segue into Christy's presentation?
Yeah, there is one, and it's around demographics for your study. So in terms of gender, race, can you give more specifics on that?
Yes, although I can't remember them exactly off the top of my head. There were more women than men, maybe not surprising. And it was an audience that was more white than anything else, but it was mixed. So how about can I do a follow-up email and be precise? I'd be happy to do that.
Absolutely. And I will say that we did put a link to all of the resources that are related to the presentations today in the chat box, as well as specifically the Altarum report link is there as well.
Thank you so much.
Well, thank you once again, Ann. That was really wonderful. And I have read the report, but I still learned much more. And thank you for everyone who commented. So Christy Stoker, I'm really excited. You know, Ann has set it up so nicely and really eager to hear some of your experiences at Clark Lindsey. So I will turn it over to you. And you'll need to unmute your mic.
I'm working on it. All of a sudden my screen went really wonky, so.
Okay.
It was probably Mary and I getting in cahoots here.
There
Well, good afternoon, everybody. Can you hear me okay now?
We're good.
Good. Okay, good. I just wanted to share a little bit. First of all, thank you for having me share. We can go on to the next slide, Mary. I am from Clark Lindsey. I'm the guide for the greenhouse homes. And just to give you a little backdrop on Clark Lindsey, we are in East Central Illinois. We're a life plan community. We have 16 villas, 130 private apartments. We have our Meadowbrook Health Center with the capacity 3 staying with us. We're not at that capacity right now, but within the Meadowbrook Health Center, we have the Renewal Therapy Center, which is our short-term rehab. We have long-term skilled care in Meadowbrook as well. And then we have our 2 greenhouse homes. So we have our long-term skilled care greenhouse home and our assisted living memory care home with the capacity of 12 elders in each home. And we'll go to the next slide. Right now, actually to this point, we have not opened up for indoor visits yet. At the point at which CMS gave the new guidance for that, we had our own positive cases that we were dealing with in our community, and so we were not able to do the indoor visits. And then our positivity rate in our community is really high. The community at large in the state of Illinois actually is all under mitigation right now. And so we have had to push back our plans for indoor visiting because of that. But that process for the indoor visit is still going to be very similar as far as the scheduling ahead of time, the screening, the phone screening. And so I entitled this slide, Tale of Two Spaces. We have what we do for in Meadowbrook Health Center, and then we have what we're doing in the greenhouse homes. As far as the screening in advance, that is all very much the same. People call within 24 hours of the visit. They are screened either by the life enrichment director if they're in Meadowbrook. In the greenhouse homes, they talk directly to the Shabazim who are working in the home. My pictures there kind of show the visiting area at Meadowbrook Health Center there on the bottom left. it was a nice shady area. We had a shade umbrella. There isn't any visual obstacles in that as far as the resident and their family member can interact together, socially distanced, of course, with their masks on. And then there is, the Life Enrichment Director did spend, and still does, some time just not right there, but kind of off in the distance, kind of watching what's going on, just to ensure that those proper distances are being kept and that the masks are staying on. In the greenhouse homes, we wanted to take advantage of the fact that we had this lovely courtyard just off of the dining room, and we already sort of had some landscape that's set up for some social distanced areas. There's 3 feet on each side of our courtyard fencing there, and so we have the elder is on the inside of the courtyard, their family member on the outside, and that allows for them to have that quality visit without having to have anybody out there with them at the time. It's completely private. We have some visual oversight through some long windows in our dining room. But we don't have to be underfoot. We don't have to be really close. So that is working very well for us. Go ahead and go to the next slide. Some of the challenges that we have had in starting all of this when we first got started was, you know, our families are so important. They're so used to coming in when they want to, and just getting people used to the idea of needing to schedule in advance so that we didn't have people bumping into each other. Just getting them on board for that, and also just communicating as far as education of that. We have a weekly email that goes out to all of our family members, kind of giving them an update on what's going on in the community, in our Clark Lindsey community, but also a reminder of just some of those processes so that it really gets familiar to them. And then having them posted in those outdoor spaces so that they can see, you know, what needs to happen in order for us to continue to maintain these outdoor visits, which the residents and our elders really respond to having that time outside together. They're enjoying the outside, but we're getting a little cooler. So that's coming up with some interesting challenges coming up. Before they even are able to have that time outdoors together, though, the person coming for the visit is screened in person. We have a general screening station in our main building, and so everybody goes to that main building for screening in person for the temperature check and asking the questions, and then they get a little sticker verification that they have done that process, so that when they come to the greenhouse, our staff know that they've done that, and that way our staff who are working in the greenhouse don't have to take the extra time to be taking the temperatures and all of that. That's done away from the greenhouse. Families just in their efforts to connect with their loved one, and I totally get this, but the temptation of taking that mask down is there all the time. And so just reminding staff the importance of having the masks on, of having that appropriate coverage. And then for our elders as well, just you know, sometimes they forget that they're supposed to have a mask. They don't even understand why they have a mask on. So sometimes that requires a little bit of assistance by the Shavazim who are working with them, and just a reminder to keep that on. Those visits outdoors can create some challenges with communication. And so for some of our elders, it became very obvious that the outdoor visit really wasn't the best way for them to get a quality visit with their loved one. And so for them, because of hearing challenges, because they couldn't, you know, maybe they read a little bit of lips, and with the masks, they can't do that. The environmental noise from the outside. Sometimes those window visits are a better quality visit for them, with both people on a phone and able to see each other through the window, so that they're actually able to connect that way. And so we have some elders that the window visits are actually better for them than the outdoor visits. But then also taking advantage of technology, and I love that Anne was talking about that. We've had great success with Portal, and I don't know if anybody is using Portal in your homes, but we have some elders whose family members have set up portals and sent them to us, and then the elder can just say, you know, call call Mary and it rings a daughter, and they're having a beautiful conversation back and forth in the comfort of the elders' room. So I just wanted to put a plug out there for Portal. I even purchased a Portal for my mom and dad for their birthdays earlier this summer, when it became very apparent that we would not be spending a lot of face-to-face time here for the foreseeable future. Now that it's getting cooler, the temperatures challenge, bundling up the elders, making sure that they're comfortable. We have patio heaters that we purchased to have on hand, and so trained the staff to use the patio heaters so they know how to turn those on and turn those off afterwards. We've also purchased some tents, some awnings to start going up as we head into the colder weather. We are trying to prolong our move to indoors. We're trying to hold off as long as possible, keeping a comfortable outdoor visit for as long as possible. And so one of the ways that we're doing that is with tents and patio heaters. We'll go to the next slide, Mary. Thank you. So that I wanted to just show the picture of our patio heater there, the type of tent that we got, and then the sides will come down. We'll keep a couple of sides open. And then there's a picture of our screen porch that we have in our greenhouse homes, and I'm thinking we can do something creative with our screened area to provide a wind buffer. We might have to put an extra door in to access from the outside, but those are ways that we are trying to get our elders and their loved ones together in a way that is safe and mitigates risk as much as possible, given that we have a lot of guidance and regulation from our Illinois legislatures and our IDPH. So we're trying to navigate that, and looking forward though to bringing people inside. And I'm excited to see some of the suggestions coming up as Mark is going to be sharing with us. We might glean from his experience in indoor visits as well. Thank you very much.
Christy, thank you so much. That was wonderful. And you actually answered some of the questions that I had and that I've had people ask me. So thank you for that. Anybody else with questions, I'd love you to put them in the chat box. And then I'm going to go right to Mark. And we're going to do Mark's presentation, and then we'll take all of your questions at the end of that. So we'll go to Mark's slides and hear from Mark. Thanks again, Christy. That was wonderful.
Thank you.
So while Mary's starting to cue that up, John Knox Village, we're in Pompano Beach, Florida. We opened in June of 2016. We are a life plan community. We have close to 1,000 residents and elders here at John Knox. We have 12 greenhouse homes in the Woodlands. It's a 7-story building. 4 of them are dedicated to short-term rehab. And we also have long-term care homes. Thank you. Next slide, please, Mary. So we have a total of 184 lives that we're responsible for from a skilled nursing setting. Next slide. So we all know we're in this pandemic. We've been talking about it. It's been an amazing challenge that we all are experiencing. I must say that the Department of Health in Florida, the Agency for Healthcare Administration, Leading Age Florida, we've all come together. They have really worked as partners. I encourage you to reach out and use them as resources if you haven't already. We've had times where they came in and did testing. I will say John Knox Village is one of the things that one of our secrets is we spent over $100,000 to date on PPE supplies and testing kits, something we have to do. So even at the beginning, we were never short of PPE supplies. I think that one of the most exciting things in having a greenhouse home is we never planned on dealing with this pandemic when we decided. Having individual homes separate and then with all private rooms has helped immensely, obviously. And the record shows the greenhouse homes across the country with the much lower numbers of COVID. And we've had 0 elders contract COVID in any of the skilled nursing greenhouse homes, 0. And I'm proud of that fact. And I'm a little bit militant as it comes to this process, which is kind of very anti what we've done in our social model in the greenhouse, but it's something we've had to do. And the visits, though, when we started opening that up, is definitely something that's helped us. The deep relationships, we have deep knowing. However, there's nothing like their loved one, their son or their daughter or their spouse. And we've had so many spouses that live on the campus and haven't been able to come and see their loved one. And they've been understanding, they really have. We've had a lot of communication. We sent out communication twice a week with updates. We did Skype calls, the Zoom, FaceTime, all those things leading up to this. Next slide, please. Now, Ann did an amazing job of talking about some of the things that we've had to deal with. We had a situation where, okay, at the height of the pandemic, no visitation whatsoever, except for end of life. We had a scenario, husband and wife, they've been married 66 years. She hadn't come to visit him in 2.5 months. He started having nightmares in the middle of the night, thought his wife had left him. Tried to walk, he couldn't walk, and he fell out of bed. I said, guess what? That's an essential visit that needs to happen. And we brought her in and we, did screening, and she came and visited him. I said, we're not going to keep him safe from COVID, and God forbid he falls and kills himself. So those are things, we have to be able to pivot and adjust to the situations. Once the visits were allowed, it was kind of exciting because you'll see in the next slide after this, but we had a 100-year birthday that took place. PPE visits, as you can see, the PPE kits, we provide them with a KN95, a shield, washable gowns, and we renew them. They pay a one-time fee of $10. Not one person has griped about it, and they wear that. We have the visits outside the homes in 1-hour increments. Those of you, as far as a screening tool, the Quixie tool is on here. It's an electronic tool. Our employees use it. They used it at the gates. We started with paper screening. We had took a lot of staff. I wanted to see if I could pull it up here on my phone. This is kind of the Quixie tool, and you download the app and it tracks everything. So I would highly recommend you checking into that. Next screen. All our visits are in fact tracked. Here's a sample of the PPE kit. We opted to go with washable gowns, and they get the KN95 mask, all the supplies, and they leave the washable gown in an infection control bin. The next time they come, we give them a fresh gown every single time, because gowns became a hot commodity. Next screen. So here's a husband and wife. This is actually our bistro area. And before we were allowed to do these visits, well, and we see we had the plexiglass as additional protection. They're visiting one another. Our bistro is currently closed. It's on the first floor. It's a restaurant setting, so we're using that. We have an outdoor gazebo. We have an outdoor patio. So, and what we've done is we have, again, I've been very, 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 very strict on the scheduling of the visits. They call up, they schedule through the concierge. They come to these designated areas in 1-hour increments, and it's worked immensely. If it's end of life, or if it's a scenario where the elder can't get out of bed, we do allow the spouse with the PP or family member to go up to the home. Next slide, please. And then this was an example, literally 2 days after the governor allowed visitation, we had the news, seven different news stations, and we celebrated her 100th birthday. Her daughter came in, they FaceTimed in family members, and it was outside. So we were able to social distance, and we had a lot of our Shabazim and nurses surround her for that. Next slide, please. And we had another elder, 103. And as you can see on the screen there, she's got her family members, and we had a special birthday for her. We're fortunate, as I hear you talking about the winter weather coming in Florida, we're not going to have to deal with that, so we'll be able to continue the outside visits. It's about partnerships in the homes. When everyone was on isolation, you can't have congregate dining. We took our large table. Remember, Dr. Thomas, everyone deserves a spot at the table, and we split those up. There were 6-foot tables, so we were able to allow social distancing, and we actually could have 6 elders out in the dining area at the same time and keep them safe. So It's about creativity and doing whatever it takes. And my time is probably up.
Mark, that was fabulous. Such great ideas. And I loved what both of you have said, and it kind of builds on what Anne said. And creativity is really essential, and really hearing the elders' voice and recognizing the need for human connection. So I'm going to open it to our panel. Eric, Al, I'd love to hear from you. And Anne, if you've got questions as well, we're going to start there. And then if you have questions, please put them in the chat box, and Marla will share those with us in just a moment.
Just want a quick comment about what Mark's presentation. By the way, Mark, great presentation. You pointed out, a mechanism for appointments. That's very important. You have to make sure that there's a strategy for scheduled appointments. First of all, God forbid something happens, you can do contact tracing and find out who's the specific person who was positive or who has had a contact with somebody who was infected of COVID. And also, you have to really make sure that everybody has a chance to visit their loved ones. One important strategy, what we did, we got this computer program. Actually, it's from a beauty salon program, and it worked for us for outdoor visits. What happens? Family members will just put their schedule in, and there you go. There's no time slots that are getting bumped in. Everything is all well planned, and you can email or text the family or the loved ones if we have to cancel due to inclement weather. So I think, as I said, you have to find innovative ways, and this really did work for us. We really strategized it, and everybody had a time to visit their loved ones. So communication is the key as well, and also you got to explore some what's good computer program or electronic programs out there. So it's very good.
Thanks, Eric.
Thanks a lot, Mark and Christy, both great presentations. After Ann kind of set out the scope of the issue, you both gave some great ideas. And I think the comment I'd like to make is just to take some of the great things I've heard and just outline a couple of principles that came to my mind for other people moving forward. First of all, I've known the Greenhouse Project since it started. And one thing they did was they took the intent of regulations and said, how can we meet the intent in a different way? So a lot of this is about taking the regulations that we have and saying, how can we be creative? And you both mentioned creativity. I think another point is that while operations like consistent staffing are extremely important, structure is also important. And it's not something every home can fix right away, but not only the private rooms, but the easy access to the outdoors, the open floor plan that enables what do you call it, distance socialization. So you can have people at the dining room table, people with TV trays in the living room. You can still have things like activities and meals. Love the outside use. Love the idea of the patio heaters. I was speaking in Norway once and had a very comfortable hour in an outdoor cafe in November. Between wool blankets and heaters, you could just sit there with a cup of tea and be very comfortable. I think another principle is using our known science to negotiate risk. As we said, there's risks to doing, there's risks to not doing. So how can we take what we know? And I think Mark highlighted this with visitation. A coronavirus doesn't know if it's sitting on the hand of a family member or a staff member. And so if you have the same approach to screening, to gowning, et cetera, there should be no greater risk with one type of person than another. Using science to figure out where you can take chances, where you can negotiate risk versus the other thing. And part of that, I think that also came from your talks, is finding what the non-negotiables are. Mark talked about what he was firm about, what he's militant about, but then within that, how do you find the nuances? And the other great thing I got from the example is that fair is not equal. Policies tend to be equal, and they punish everybody because they don't recognize individuals. So what is fair? Maybe visitation in one way for one person, like the person needing end-of-life care. It may be outdoors for one person. It may be indoors for a person that can't be outdoors for some reason. And so this really challenges us to look at individuals, to take the non-negotiables, but say, how do we apply this to the special case of every single person? So I applaud you both for a lot of great solutions, and I'm sure there are others on the call as well.
That was wonderful. And did you have a comment before we go to the other questions?
Well, basically, my comment is that you're both doing a splendid job. Thank you so much for the kind of detail that you shared. It's invaluable. And I guess I had a question. Has there been any changes that you've made, or have you thought about whether advanced care planning or bereavement has shifted in any way or should shift? I didn't talk about that, but we did do a question on that in our survey. So I just wondered if you had anything to share on those topics, either one of you.
I mean, we make sure that we do put in the care plan, the visitation, and want to take credit for those. Nothing really more complicated than that.
Right. And two, just recognizing that if we're in an end of life situation, we don't have we don't put a limit on the amount of visiting. We don't put a limit on the number of hours that a family member spends with their loved one when they're in an end of life situation. Compassionate care visit is not just end of life, as Mark stated, and we've had some elders who were showing distress and just they needed to have an opportunity to see their family, and it was because they were not thriving at all. They were spiraling down, and so it's looking at all of those scenarios and really paying attention and meeting their needs. Meeting their needs, and then having that opportunity for families to be a part of that.
Congratulations on that. There's so many people, and the saddest stories are those who were not able to be with their families, really, at that time. And so thank you for being so careful and so open to making that happen.
Well, thank you both. And Marla, do we have a question that we can fit in before we adjourn?
Yeah, I think it's a quick one. So a couple great comments. One comment about the colder weather, it's a great opportunity for hot chocolate when you're outside, so it can be fun as well. And then a question around, do you use styrofoam or regular place settings and utensils right now?
Good question. When someone comes from the hospital for short-term rehab, and we have them on isolation in a rehab home, and in one of our rehab homes, we have 4 rooms that have been designated as a COVID isolation area. We actually scaled it back to 2, fortunately. But in those homes, when someone is on strict isolation, unfortunately, we do use styrofoam. And then when they come off isolation, we go back to our regular china. Yeah.
Yeah, we don't have necessarily isolation in the greenhouse homes. Right now, we haven't had to, and so we're still using our regular plateware.
Great. I think it's a great question and a great topic for discussion and debate as the months roll on, because we have tried so hard to move away from being a disposable society and to recycle and to reuse. And all of a sudden, COVID has pushed us back into use it once and throw it away. And so I think since it's with us for the long term, it's going to be a great topic for debate in the policy.
Thank you for that. And thank you everyone for your questions. Thank you so much, presenters. You did a wonderful job. We've got a couple quick polls, and it will help us to kind of, as we plan our next session. So Mary, you want to launch our next poll? What do you anticipate being the biggest challenge related to the holidays? We've got holidays coming up this month, next month. So when you think about it, where are you feeling the most challenged? So dining, visitation, maintaining rituals and a sense of normalcy. There's an all of the above or something else. And if you've got something else, please put it in the chat box. We'll just take a few more seconds to get your thoughts. Okay, Mary, I'll have you close the poll. All of the above, how about that? Not surprising. I think probably everybody would be feeling a bit challenged. All right, one more poll before we adjourn. What has had the greatest impact on your organization's senses? You can take a look here. You know, it's interesting, everybody has really talked about how challenged they have been with regards to census. I think I saw 73% was the average census now in nursing homes. So let's think about the greatest impact on your organization census. All right, Mary. Another all of the above. And it looks like lack of public trust in nursing homes and workforce shortages were kind of tied. So not surprising for sure. So it's I'm sorry, there's a chat here. How should we approach a resident who wants to, I think Al might have just said, so how should we approach a resident who wants to spend some time at a loved one's house? Oh, the next session on holiday. So you'll have to come back for our next session. Yeah, thank you for putting the teaser out there. That was actually my next comments. I invite you back 2 weeks from today. We will be having our COVID-19 best practices in nursing homes. We'll be talking about holidays and visitation and really thinking about the challenges that Serena, you just talked about, and what does it look like, you know, going and, you know, we've been talking ourselves about what does it look like for our Thanksgiving holiday and gathering the family around the table. So good questions, and it's something that especially in our communities, we really want to hit hard and talk about it. So thank you for your time today. Thank you, presenters, once again. This was so fascinating to hear from all of you. Thank you for your creativity, your diligence, and all that you do to really make a difference in the lives of the elders and staff that you serve. Take care, everyone. Be well, be safe, and we'll see you in a couple weeks. Bye.
Bye-bye.
Thank you.
Thank you.
Thank you.